the live long day, all the live long day. I'll be moving along, singing my song, running around, ain't nothing wrong. All the live long day. I said all the live long day. Baby got her shoes on, she wants to move. Yes. Looking for trouble, honey, is it you? Feel the world under her feet, all the cracks up in the concrete. Take a step back, she's coming through. Baby looking shady, she's on the run. Maybe, just maybe she'll find the sun. All the live long day, all the live long day. I'll be moving along, singing my song, running around, ain't nothing wrong. All the live long day. I said all the live long day. Baby got her shoes on, she wants to move. Yes. Looking for trouble, honey, is it you? Feel the world under her feet, all the cracks up in the concrete. Take a step back, she's coming through. Baby looking shady, she's on the run. Maybe, just maybe she'll find the sun. I feel that sweet Indian summer, feel the heat.
Welcome to Healthy Body by Sophie and a new episode of working your gluteal muscles and your thigh on the side where your iliotibial band or IT band is located. Those areas are really tough tissues to get through, which is why my husband and I have been using a simple tool such as a ball. You don't have to get a fancy tool or ball on the market. Just get a basic baseball, a T-ball, a tennis ball, a ping pong ball or similar balls like this racket balls, and even a wooden ball. We like to use a baseball and also some lacrosse ball work, right? I do like to as well use a T-ball, and we also have the T-ball in not the baseball size but you also can find it the softball size here. I don't have the softball here to show you, but it comes as well into the hard leather. All right, so why use a ball to work trigger points? And by the way, these can be used for anywhere on the body, really. We're focusing on these two areas right now, but it's perfect when you put it in a sock like this one and to do it against the wall, working certain tissues of your body. So why use a ball? Well, you could wake up in the morning, for example, with a pain and you're like, well, why am I having such a pain in my glutes or in my IT band and I have to go for a run this morning? Well, don't get discouraged and decide, oh, I can't go for a run today, or I can't go to work, or I can't get up. Try to starting to use a ball. You can first do it by just rolling it on you. Obviously, that's not gonna get in the really tough tissues, but it's a start. You can do it against the wall standing, and then eventually you can graduate. That's how we work with our patients. Eventually they can graduate once they've used those other ways, just by rolling it manually with their hands or against the wall standing. They can eventually graduate. The best way to get those areas is laying on the floor on your side or front, depending what you're working, even the back. And you can have pain, but even when you don't have pain, you work on those trigger points with the ball. Why? Well, because those tissues were tough and needing attention before they started hurting you. So the best way is to be preventative. Preventative medicine is the best way to prevent injuries and for longevity of your body. It also makes you feel better because you're less in pain, more mobile. When actually my husband has been using the baseball, that's his friend. He doesn't go with a tennis ball, which is completely fine. It depends on your pain threshold, and whatever your pain threshold is, work with that, of course. And it's better to go for a shorter period of time, 10, 20, 30 seconds. Do it, but it's definitely better to do it on the floor. Once you've warmed up just for a few seconds the tissue of the area that you're gonna be addressing, increasing the frequency and repeat it more often. Even on the hour, if you have a desk job, get up every hour. Have your phone warn you every hour, remind you. Get up, go get a glass of water, and do a trigger point release for 30 seconds or 10, 20 seconds. Who doesn't have that amount of time? Really make the time for that. You just have to create the routine. That's really the key component. I would need to warn you, you may get a bit of bruising, and you know, you might feel bruised and sore to the touch, and might get some physical bruising as well, but that is normal. Those tissues are very tough. Anytime you're running, you're exerting on an average 800 pounds for the average male, and that is a lot of pressure, 800 pounds with every step that when you're running. So if you just go like this, it's not gonna do anything. I mean, it's gonna temporarily help, but it's not gonna have any long-lasting result and you know, progress in your health and tissue mobility. Now, on a side note, if you are, for example, have a medical condition and are on blood thinner, then I would arm on the side of caution as far as paying attention to that bruising effect. If you see definite visible bruising of the area, because then the capillary beds are a bit more fragile, then make sure that instead of using a baseball, you might go to the T-ball that's a little bit softer, there's a bit of give in it, or the tennis ball. So if you're on a spot like in through here where it's not as tender, you can add a weight. If you're still having some issues, or you want to see if you have more restriction deeper, and that's what we do if we want to really get into those trigger points. And if it doesn't necessarily bother you, you can sit with that and work on your breath work. That's a good time to include a bit of breath work and meditation through there, yoga, stretching. Nice breath in and exhale. Elongate that exhale movement if you are trying to accomplish a relaxing movement and decreasing the pain. And you could move a little bit your body up, and then as a result you go more into the back of your gluteus, which then you're getting into your gluteus maximus, just like that. And you can turn this way. So now my body is face up, and I have the pillow or bolster for my head, and you relax in that spot. If it's very painful, then just do that for just 5, 10, 15 seconds at the very most. Breath in and exhale, let go fully on the area, and then get off of it. And now we're going to work the glute seated. So for this, like I said, I don't have my, I'm gonna use the, behind me we have the yoga ball, so it's against the wall, it's not gonna move, so that's perfect. But like I said, you could use your couch and work that area. I'm gonna move this out of the way. There we go. Again, I like to use it in a tube sock, but you could use it just a plain baseball like this. This way, if I use the baseball in a tube sock or sock, if it kind of slips, because it's that faux leather material, so it's kind of slippery, then it's not gonna go flying on the floor, because it's in that sock and it's not going anywhere. And to support, now I'm more at the base of the sacrum, at the top, as the sacrum is in this position. It's a triangle, and then at the top of the triangle here, the top part, then you start having your vertebrae of your lumbars, the lumbar vertebrae. And then on the sides you have the bones that makes your hip and your hip girdle. So I'm gonna really try to keep your leg more neutral, like with your toes pointing up towards the ceiling as opposed to out. Alright, so now we're going to work the glutes. I'm gonna move this a little bit back to be closer to the the yoga ball, and I'm going to bend my knee. So in bending my knee, I'm gonna get deeper into those tissues of the glutes, and I'm gonna get as well into the piriformis. There's a specific spot for it, but I'm really working the whole glutes from the lateral part of it, moving middle and inward toward the sacrum. Then I move higher up by pushing my body slowly down towards you, and same thing, more medially, so that's more the center inside, and moving my way out, just shifting my body, moving slowly, okay? But it's very slow movement. And try not to let your leg open and hang out. Just keep your hips nice and pointing in the same directions, with your knee pointing like if you were standing, and just like this. But I'll have to say that using the big ball like this, if you can find a setup like this where you have it secured where it's not moving, like we have right now, that is actually pretty ideal, I will say. Good. And if you want to go even further, you could even add this. That would make it even more. Now you're really getting into as well the piriformis a bit. Especially as if I shift side and I do this with this side, now I'm getting into those tissues. So instead of having this leg up, as we keep working the left, put the left leg up instead, and get into those tissues here. So there's a lot you can do. Use that yoga ball, is very helpful, and get into those tissues. Then you're gonna work your TFL. TFL, you have your bone here. You can feel it. You just go on the inside of it and drop down. You'll be on your TFL. So here on the side, you gotta go lower, then your hip there, and then you go into, so you below your lingual ligament here. And so it's between, you have your greater trochanter here, and then that hip bone. So all this area right here, then you're gonna move down a bit forward, just right in there. So you could use as well the foam that will give you support, and you could go on the floor if you with your head to rest it, or you could be in this position here if it's too much stress on your shoulder and elbow. Then you use that tool here that we love, that bolster, or a pillow, and you would go like this. And just like this, move your thigh, that's free, forward. You could even use the bolster if you prefer the bolster. You could have it in front of you and rest your leg like this, or pillow, or you could have it between your knees again. But for this one, I think it should be a little bit off-centered from your other leg. and be in this position with 2 pillows. If you don't have these bolsters, there we go. So right in here, you're getting into your TFL, and that's a pretty good spot. That's referring up and down. I'm even feeling it down to my ankle. Relax your arm down. There we go.
I'll be moving along, singing my song, running around, ain't nothing wrong. The live long day. I said, the live long day. Baby got her shoes on, she wants to move. Looking for trouble, honey, is it you?
And if that's all you had, and you chose that, you know, this is the area that bothers you, your piriformis all in there is hurting, you would address one spot here, one spot in here, your gluteus minimus, and then your IT band. So you would go on here, okay, that's count for your 30-second or minute you have at your hour break from working, and you really focus on there. You can have your leg up here if you can, and take a nice deep slow breath and relax as much as you can. Let it get in there. That's it. And then go get some water, go to the bathroom, and go back to work, and do that again in an hour. Thank you for watching. Have a wonderful day, and I shall see you in another episode of A Healthy Body by Sophie.
All the live long day, I'll be moving along, singing my song, running around, ain't nothing wrong. The live long day. I said, the live long day. Baby got her shoes on, she wants to move. Looking for trouble, honey, is it you? Feel the world under her feet, all the cracks up in the concrete.